Every day, millions of Nigerians wake up to face not just the challenges of daily life, but invisible battles within their own minds. Depression, anxiety, trauma. Yet, when the mind cries for help, where do they turn?
We don't have a lot of mental health facilities available, and the ones that are available are mostly privately run.
The obstacles people face in accessing mental health services. Number one is availability.
This year's World Mental Health Day focuses on a critical truth: mental health in catastrophes and emergencies.
Let's talk security now. In Plateau State, a midnight invasion by gunmen suspected to be militia headers have left 8 people dead, with many others seriously injured.
Nigeria knows this reality all too well. From the insurgency in the northeast, to ethnic clashes in the north-central, to devastating floods, economic crises that leave families struggling to survive.
I usually tell people that if you ask where they can access care for diabetes, for malaria, people will name a number of places. But for mental health services, they are things that you can count on your fingers. So psychiatrists are very few and far in between.
Families in Basa, Bokos, Mangu know what emergencies feel like. They have tasted it. When disaster strikes, we count the physical casualties, but what about the invisible wounds?
Yesterday night, as at 6 in the evening, I myself, we are on patrol and some of our guys around. We are patrolling around, all of a sudden we have gunshots.
The trauma that doesn't bleed but cuts just as deep.
Vigilant and also taking note of their surroundings. Around about 12, after 12, we discover some militiamen known as headsmen who invaded Ziki, Kimakpa community in Kol district of Irigwe Chiefdom, Basa local government area.
And even when the crisis isn't natural, Nigerians face daily emergencies: the crushing weight of unemployment, the trauma of insecurity, the stress of surviving in an economy that seems to work against you.
Close to accessing. One is stigma. A lot of people will prefer to spiritualize mental health and feel it's an attack of the devil, and because of that, they don't seek care on time.
Nigeria has roughly 250 psychiatrists for a population of over 150 million people. That's one psychiatrist to every 700,000 Nigerians.
Because the specialists are few and far in between, psychiatrists are very few, clinical psychologists are very few. These are professionals, they need to be paid. Medications have skyrocketed and all that. So sometimes people access care, but they are not able to afford. And so they abandon the medication eventually because of
And so if you live in a rural area, the nearest mental health facility could be hundreds of kilometers away. But access isn't just about distance. It's about costs. Health insurance, well, it rarely covers mental health care.
And we have our mental health act now that has been passed into law that is regulating the practice of mental health to help in terms of help the dignity of the patient and of course the practitioners and so on and so forth. So these are some of the things that have been done well. We're opening up spaces. When we were younger and in training, like I said, people come as far as Cameroon, Adamawa and all that. But right now, you can see in contiguous states, we have some form of mental health services, either a consultant there or a clinic there and so on and so forth. So we keep on opening up. And then we are also seeing that we're integrating mental health. We're trying to integrate it into secondary care and primary care.
But perhaps the greatest barrier isn't distance or cost. It is silence.
Stigma, and the major problem is stigma. 'Cause the major problem is stigma. Stigma, and 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 the major problem is stigma. Because even those who can access treatment tend to deny what is looking them in the eye and in the face until it's too late. The stigma hides the problem until it is too late to be hidden.
In many Nigerian communities, mental illness is still shrouded in stigma. It is seen as a spiritual problem, a curse, a sign of weakness. People suffering in silence are told to pray harder or be strong.
Even people themselves, they believe about the causation of mental illness. So they will probably have gone to, in our place, they have local traditional healers, gargajiya, pastors, and all those things. By the time they are presenting to you, it is actually many a times complicated cases and all that. So even the belief system. So we have alternatives that people.
The theme of this year's World Mental Health Day reminds us, in times of crisis, mental health care is not a luxury. It is a lifeline. But there is hope. Across Nigeria, a new generation is breaking the silence. Mental health advocates are using social media to reach millions. Community organizations are training people in psychological first aid.
We keep on training and retraining. I just came back from the exam where we just graduated some people as specialists, either specialist registrars or even as consultants. So we keep on training.
Institutions like Netwealth Consult are setting up homes and psychologists to attend to the dying and growing needs of people with mental health struggles. When disaster strikes, whether it's a flood or a conflict or the quiet catastrophe of poverty and unemployment, our minds need care just as much as our bodies.
Until people begin to see mental health disorders as nothing more serious, or rather worse than normal physical health, malaria, typhoid, and co. And not just look at it as a stigma and a social blight. It will continue.
This World Mental Health Day, let us remember, there is no health without mental health, and there is no emergency response that is complete without mental health care. The mind that cries for help deserves to be helped. If you or someone today needs help, reach out to Netwealth Rehabilitation Center on the number showing on your screen.